All right, good morning, everyone. Thank you so much for joining us today for our first Let's Talk Parkinson's of the year. Today we have our Parkinson's New South Wales registered nurse, Melanie Ledbury, with us. So welcome, Melanie. Thank you so much for joining us today. Melanie's going to be taking us through building your healthcare team and preparing for your appointments. So over to you, Melanie, whenever you're ready.
Thank you. Good morning, everybody. And Stacey, thank you for inviting me to join everybody this morning. Okay. So we're just going to talk about creating your healthcare team, how we go about this, and the reasons for doing it as well, the benefits to your overall health, and preparing for appointments as well. So living with Parkinson's means you're navigating both motor and non-motor symptoms that can impact a lot of aspects of your life. Creating a team, a multidisciplinary care team, is a great way to ensure that you receive very personalised care. Also, comprehensive care, so that you're looking at a lot of different people to form a support network around you. So we recommend that you get that team together as soon as possible. Now, when you are diagnosed with Parkinson's, you may already have some members of this team that are there supporting you and have been there for a long time. You also may feel that you need to add to the team, and you also may want to make some changes to your team. So we're going to talk a little bit about how you create the team and how you make some changes along the way if you need to as well. So what are the benefits of a care team? Well, firstly, no two people are going to experience Parkinson's in the same way. Your symptoms will vary in the type, the timing, and also the progression of the disease. So a care team is going to bring together professionals. They specialize in very different areas, and therefore they're going to meet different needs. So you're going to have a team that are really focused on different aspects of your care, but with the overall benefit of really supporting your quality of life and improving your quality of life as well. So as I mentioned, we recommend that you start assembling this team very early. You become very proactive, looking at what you want, what your goals are, what you want to achieve in your care as well, and remembering that this is going to change and evolve as your needs change as well. So I've listed three main groups of team members. The first being your primary team members. The second group come under the umbrella of your allied health professionals. And the third group are your additional support services. And when I talk about your additional support services, you may, of course, have many more people that form this group for you. So that's also a very personal support service group. Your general practitioner is your first point of contact for all your health concerns. Really important that you have somebody that you trust and that you can build a good rapport with. They have a very, very important role in monitoring chronic conditions, prescribing medication, mental health care plans, referrals that you may need as well. Always think about the location of your GP. I do suggest somebody that's in a reasonable geographic area to where you live. Think about access to their practice. Think about the number of GPs in the practice as well. You're sort of looking at a GP who's got quite a bit of availability. You're not looking at a GP potentially who works one day a fortnight and is hard to get an appointment with. So sometimes it might be a good idea to look at a bigger practice, because if your GP is not available, another GP can see you for that consult. Also, bearing in mind that you may want to consider a practice where there is a GP who does a home visit. So again, think about your mobility. Also, transport. Are you able to get easily enough to this practice? Do you have a support team to help you get to the appointments as well? Sometimes it's good to think about a practice where at least there's one GP in the practice who can do a home visit if you need it as well. The other important role of the GP is to look at your chronic disease care management plans, which are an EPC form, enhanced primary care form. If you don't know about this form, please make a note and we can talk more about this at the end because it's a really important care plan. So second on the list is your movement disorder neurologist or neurologist. The difference is your movement disorder neurologist has more specialized and advanced expertise in the care of people with Parkinson's disease. But of course, your neurologist and movement disorder neurologist come under the umbrella of that specialist who looks after your brain and nerve conditions. So they're there to oversee your treatment plan, your medication plan, and your overall health. The third primary care team member is your Parkinson's nurse specialist. They, I feel, are a really important bridge to bridge the gap between your GP and your neurologist. So your neurologist has consulted with you, you've seen your neurologist, they don't want to see you again for another 6 months, but you just need some support and some care. Some new symptoms have come up that you want some direction with. We also have our clinical nurse consultants who are able to give you some really accurate medication review and advice as well. So their role is to really enhance your overall daily living and to give you that really important advice as well. So that's your primary care team. Your allied health professionals, as you can see, there are a number of allied health professionals important in your care plan. So a physiotherapist is there to diagnose and treat an acute injury and acute pain and movement dysfunction. They use a lot of hands-on treatments. They may decide to use massage, hot and cold therapy as well. And they're there to generally improve your strength and balance. They do personalised treatments, and they can also recommend equipment if they think that that would benefit your quality of life as well. And I'll talk about the physiotherapist and the difference between that and exercise physiologist a little bit later too. Your occupational therapist takes a lot of direction from your physiotherapist, so they may put some devices and some home modifications in place to help you maintain your independence. So an occupational therapist will come to your home and do a thorough assessment, not only of your home environment, but also looking at you yourself, the aids you might walk with, your footwear, looking at safety devices such as vital cord pendants, and looking at your transferring from your bed to a chair into the car to provide equipment and support around that as well. It's really important that you get an assessment so that you're safe getting in and out of your car, getting in and out of your home, and moving safely around your environment. Okay, the speech pathologist. Very important. And when we get calls at Parkinson's New South Wales, we talk a lot about exercise and physiotherapists. We always include the speech pathologist in this group because their role is to really support communication and safe swallowing. Your throat is also, of course, a group of muscles and needs to be really maintained. If the muscles become weak, that's when you lose volume and strength in your voice. They are excellent as well as helping with managing saliva, so excess drooling and swallowing issues. The speech pathologist, once they've done the assessment, can also direct you to some other treatments that might be beneficial. So making sure that you speak to us here on the InfoLine, get some information and advice. Drooling and saliva issues, excess saliva, can be embarrassing. They can also limit you from wanting to go out socially. There's a lot that can be done in terms of working with a speech pathologist, improving the muscles. There's medication. There are devices as well. And also your neurologist may speak to you about some Botox treatment as well. So there is a lot that can be done to help you if you're finding that that's a problem. Your pharmacist, make sure that you have a nice local pharmacy that you trust and that's accessible. that you can go and have a chat to them about anything and medication related. Make sure you let your pharmacist know your comorbidities and also any other medication that you're taking. So vitamins, supplements, anything that you think might be of benefit, always run it by your pharmacist too. They need to have a clear look at exactly what is in the product to make sure that it's not interfering with anything else that you're taking. So really include them in that healthcare team. A dietitian can provide you guidance on nutrition in improving your overall health. Sometimes you may experience some weight fluctuations and other issues such as constipation. The dietitian can really work with you to manage some of those conditions. The dietitian will assess you thoroughly and look at your comorbidities and medication, and will then suggest even a supplement to help maintain that weight or to help provide that nutrition, the proteins and the vitamins that you might be missing in your diet. Okay, your mental health professionals. Now, your physical health and mental health are imperative to your overall well-being. Make sure that you firstly visit your GP, discuss a mental health care plan, let your GP know how you're feeling, and the GP might be able to refer you on to a psychologist or a psychiatrist or just prescribe some medication. There's a lot of coping strategies for anxiety and depression and other challenges that can be discussed. And also there's cognitive therapy. So important to make sure that you let your GP know and your neurologist know how you're feeling. We also do offer counselling here at Parkinson's New South Wales, and I'm more than happy if you want to ask me more about that at the end and how you refer to our service as well. Really important that your physical and mental health are really as important as each other. Now, the exercise physiologist varies a little bit to your physiotherapist. Your exercise physiologist is more looking at chronic, long, ongoing management plans for you. So they structure programs that are looked at, you self-managing your care through some lifestyle modification, some behavioral changes potentially as well. But they really work on safe, personalised exercise routines as well. So it's a choice as to whether you choose to look at a physiotherapist or an exercise physiologist. They both have a very important role to play. And again, it's building your rapport and being comfortable with that team member. That's the most important thing. So the third group, what I call your additional support services. As I mentioned before, you can add to this group. You may have a number of members that are already in this group, and that's great. Getting enough support around you is essential. So your social workers can really assist you with accessing benefits that you're entitled to, financial planning, and some support services as well. Podiatrist, so your foot health, looking at improving your mobility. Sometimes mobility can be really marginally improved by specific footwear or orthotics as well. Continence specialist. I've included that because we know that with Parkinson's, there's often a lot of continence issues, both urinary and bowel. So the specialist is there to provide some strategies to help with this. We link people in with Continence Australia, and they are wonderful at providing support and advice. They will also provide you with some education and also a continence nurse specialist. So they'll actually link you in with a specialist nurse who can visit you at home and provide you with some one-on-one individual support. Other specialists, again, that would be people like a gastroenterologist or a urologist or a neuro-ophthalmologist. And that's a very individual group as well, depending on your needs. And finally, your care partners, family and friends. They support network that you you can rely on, to some share information, to also support and assist you if you're having some memory issues and in times of additional stress or change in your condition. So the most important tips I would recommend for building your team is to start early. Look at who is in your team. Look at whether you're happy with them and whether they're meeting your individual needs. Communicate your goals and where you want to be at, perhaps in a month's time or 3 months' time, realistic goals that you can achieve. Seek expertise in the area. And again, we have a provider list here where we do have allied health professionals who have experience in neurological conditions. So you're welcome to call us for some of that information and engage and build those relationships. Really important, though, to remember that if you're not happy with a member of your team, to seek a change in the team. Okay, preparing for your appointments. They can be quite overwhelming and quite nerve-wracking. Sometimes your appointment with your neurologist is very, very short and sweet. So a lot of people report it's sort of a 10-minute appointment. They walk out with a lot of other questions that they wish they'd asked. So take a list with you. Formulate that list through the days and weeks between your appointments. So just jot down your questions and any concerns that you have. Take with you any relevant paperwork, test results, or documents. So prior to this appointment, between appointments, you may have had some day surgery, you may have had a consult with a specialist, there might have been some changes to your health condition. So make sure that your neurologist is kept up to date with everything. Take some discharge paperworks or any other documentation with you, just so that your neurologist is up to date with where you are with your health. Take a support person if you can. It's great to have another pair of ears. Sometimes those appointments are short and there's a lot of information. Often in some stages of the condition, your neurologist will start to talk to you about options, and that can become very overwhelming because you're listening to new potential options that you haven't heard before. Take that support person to be another pair of ears. And most importantly is keep a symptom diary. So we have those here at Parkinson's New South Wales. I'm more than happy to either email you or send you out some copies of the symptom diary. So a symptom diary essentially is there to help your medical team to create a care plan for you. So you list your symptoms that you're experiencing, for example, dyskinesia, anxiety, tremor, and you then fill in a number from 0 to 3 that correlates with that symptom, 0 being none and 3 being the most severe. The chart also allows you to put in sleep episodes and also meals as well. So it's helping you to track what's happening in a day, because often you'll get to an appointment and it'll be difficult to determine how many times you've experienced a particular symptom or over what period of time. So this is going to help a lot to help your medical team to make a care plan that's individualized for you. So as I mentioned, please don't hesitate to contact us for some copies of that form as well. And most importantly, please call us here on the InfoLine for some more support and advice with anything that I've just mentioned to you.
Great. Big thanks to you, Melanie, for your time and your
Pleasure.
wonderful presentation.